Tim Jones is a 20-year-old male seeking care today for increasing diarrhea and abdominal cramping starting approximately 2 weeks ago with no specific triggering event. His stool has increased in watery consistency, occurring about 3 to 4 times a day. It is made worse by ingestion of solid food. It's consistent throughout the day and night, and he has abdominal cramping preceding defecation, which is relieved with defecation in ranges of 3 or 4 out of 10. He does endorse nausea, excuse me, nausea, fatigue from a lack of sleep, and weight loss, but denies vomiting, fever, chills, headache, um, hematochezia, and melena. Patient believes the infectious source could be a recent infection circulating his church group. The patient is otherwise healthy with a diagnosis of hypothyroidism for which he takes levothyroxine. He does not currently know his dose, but he does endorse having his thyroid levels checked last year and endorses that they were within normal range and his dose was maintained. He has no family or current or past history of celiac disease, Crohn's disease, diverticulitis, or colorectal cancer. Patient is independent. He has not had any recent acute infections, hospitalizations, or surgeries. He maintains a balanced diet. He is sexually active and uses condoms consistently and is an avid hiker. On physical examination, his vital signs are stable. He appears in no acute distress. His lungs are clear to auscultation. His cardiovascular examination was unremarkable, and his abdominal examination showed no signs of tenderness, distension, rebound tenderness, or guarding. And he had normal active bowel tones in all 4 regions. His rectal exam had good tone with no masses or lesions. Due to his symptoms and the length of his symptoms, as well as the patient's activities and exposure to possible parasites, my working diagnosis is parasitic gastroenteritis, such as Giardia, with the differential being viral gastroenteritis, bacterial gastroenteritis, acute, irritable bowel syndrome, and acute diverticulitis, with my can't afford to miss being C. diff. Clostridium difficile, excuse me. So in terms of treatment, I would require further diagnostic. I would like to do a stool sample with wet and cultures with assays to assess for Giardia, C. diff, and any other bacterial sources to assess for what's causing a patient's continued discomfort and diarrhea. Pending those results, we could prescribe antibiotic treatment if necessary, such as for Giardia, a dose of tindanazole 2 grams once orally. Otherwise, I would help patient with symptom management, including patient education on oral and nutritional supplementation until symptoms resolve, including use of sports drinks, water, soups, bland foods such as saltines to maintain nutritional need, and just educate on course and management of gastroenteritis, transmission and preventing transmission in this acute phase. And if the patient continues to have symptoms that affect his daily life, the use of Pepto-Bismol conservatively to help lessen his diarrhea and abdominal cramping. I would also educate the patient on needing to seek further medical treatment immediately, such as fever, chills, increasing abdominal pain, vomiting, blood in the stool or vomit, any changes in his vision or any changes in his mental status, such as confusion, difficulty breathing, stiffness or pain in the neck, and then have him follow up in 24 to 48 hours hopefully we will have received results by then, and we can also check in on his symptom management.